Thank you. The title of my presentation is Autism. Is this a vascular disease? And would angiogenesis be a potential treatment? So we're going to talk a lot about blood today, blood vessels, blood perfusion, damaged blood vessels, and also about this process shown here, angiogenesis. So angio is blood vessel and genesis is new blood vessels. And so we're going to talk about how this process is deficient in autism. Before we get to that, I want to talk a bit about the drug we're developing that stimulates new blood vessel formation, stimulates angiogenesis, and talk a little bit about this growth factor. And this is the one we have used in treating autistic patients. And also how we've used this growth factor to grow blood vessels in humans and other medical indications. And I'll just briefly go through, we've put this into the human heart. So we've grown blood vessels in the human heart. In animals that have been given a stroke. So, you know, with stroke, you have a blockage of blood vessels in the brain. Very surprisingly, Parkinson's disease, neurodegenerative disease, we and others feel is due to a lack of blood flow in a very specific region of the brain. So I'll talk a little bit about that. And then I'll go on and talk about it, how we hope this might be a potential treatment for autism. Okay, you might not know this, but you have 60,000 miles of blood vessels in your bodies, almost enough to wrap around the world 3 times. And those blood vessels are all formed by a process of angiogenesis. And we know the brain is the most highly vascularized tissue. We also know if there's a problem with these blood vessels, diseases can ensue. And in fact, there are over 75 human diseases that result from a lack or impaired blood flow. And some of those are obvious. If you block a coronary artery, you develop heart disease, block an artery in your brain, a stroke ensues. But I'll be talking about some others such as Parkinson's disease and autism, where it's not at all apparent how lack of blood flow can bring on those diseases. So we know angiogenesis, or the sprouting of new blood vessels, is deficient in autism. This has been shown in animal models where the brains of mice that have the 16p deletion, which causes autism, they're deficient in this angiogenesis process. So when their brains need blood on demand, they're not able to provide it. And the same is true in humans. It's been known on autopsy that there's a less capillary density in the brains of adult autistic patients. And this again this deficient angiogenesis in the autistic brain in humans results in some of the deficiencies seen in that disorder. And I'll talk about that towards the end of my talk. Let's just look at natural angiogenesis. The skateboarder fell off his skateboard and he scraped his elbow. He's going to use angiogenesis to heal that cut and scrape. And if we look a little bit closer, say this is the wounded area on his elbow here. This is wounded skin. And let's say this dotted circle here is the scraped area, the scab that's covering that wounded area. And if you look underneath that scab, these are brand new blood vessels, right? They're a little hard to see, but they're like little tendrils, brand new capillaries that are feeding and healing this wounded tissue. Okay, so they're bringing in nutrients, they're bringing in oxygen, they're taking away waste products. And the overall effect is wound healing in this damaged tissue. And this whole process is stimulated by growth factors. And probably one of the most potent growth factors is the one we're developing. I'll show it to you in the next slide. It's fibroblast growth factor 1, and it's probably the most potent inducer of this angiogenesis process. So if we inject that growth factor into the heart, as I'll show you, if we introduce it into the brain, as I'll show you, we can stimulate this process of angiogenesis in damaged tissue and reverse heart disease, reverse Parkinson's disease, and hopefully attempt to reverse autism. Okay, here is the growth factor, FGF1 or fibroblast growth factor. We all have it. It's in our bodies. So if you cut yourself, your body produces this FGF1 protein, and it stimulates this the growth of new blood vessels, which can then regenerate skin, regenerate heart muscle, and the brain can regenerate neurons. We make this, so this protein, I actually first worked on it many years ago when I was a graduate student in St. Louis, and we got it from, purified it from cow brains, but we're not putting cow brain FGF1 into people. We make it in a factory. We actually use what's called recombinant DNA technology. So we take the human gene with the FGF1, we put it into bacteria and we ferment it. This is a fermenter, like growing up beer. So we make it in bacteria. We have unlimited amounts of the FGF1. We purify it so it's pure, sterile, and ready for human use. So let me talk a little bit about how FGF1 initiates angiogenesis. So if you cut yourself, your body immediately synthesizes FGF1, and that's shown here. These little flying saucers are the FGF1. And let's say you've cut yourself, say in this area here. So locally FGF1 is made, and it goes to existing. This is an existing blood vessel. Here's the FGF1, and it binds to its receptor, the FGF1 receptor. So it's like a key going into a lock, and that starts this whole process of growing a new blood vessel. So you get the endothelial cells, which line all of our blood vessels, start dividing. You can see here, these are proliferating, dividing endothelial cells. Again, here stimulated by this FGF1 growth factor. And we start producing a tube here. This is the beginning of a brand new blood vessel, and it's growing directionally into the wounded area. So we have these blood vessels growing, just like we saw in that earlier slide. It's going to bring new blood vessels into the wounded area, supply that area with nutrients, remove waste products, and be involved in the healing or regeneration process. So let me just give you a few examples where we've used angiogenesis to reverse diseases. First will be coronary artery disease. And as you know, if you block your coronary arteries, you can have a heart attack, you can develop heart disease. And with our growth factor, we're not creating huge new coronary arteries, but we're treating more what's called microvascular disease, which is very prevalent. So this is an angiogram. So this is a larger coronary artery. And you can see here, there should be lots of arteries, small arteries here, but there aren't. So we inject this FGF1 growth factor directly into the beating heart in those areas that are missing these small microvessels. And you can see after about a 12-week period, we can grow what are called collateral arteries. So blocked artery, the heart tissue becomes damaged or ischemic. We introduce the FGF1, we get these collateral vessels formed. You can see this is an actual angiogram in a heart patient. So this is without treatment. You can see this dense blush of new blood vessels. This is 12 weeks after we've injected the FGF1 growth factor. So this is angiogenesis, and these patients do better. You put them on a treadmill and they can exercise better. So what's going on? The mechanism of how FGF1 works is that in ischemic tissue, let's say that damaged heart tissue, so as the heart goes from a healthy state to a disease state, the FGF1 receptors increase. They get what's called upregulated. So here is a diseased heart, basically crying out, I need more blood, my muscle's weak, my muscle needs more oxygen, puts out all these FGF1 receptors. And when we introduce pharmacologically large amounts of the growth factor, we can occupy all these receptors and kind of have an explosion of these new blood vessels form. So this is how angiogenesis gets started in ischemic tissues. And we did a US trial. I actually supervised this trial in the US, and I just want to show you, this is a 1-minute news clip. ABC News came to one of our clinical trial sites at the University of Cincinnati and filmed our cardiologist and one of the patients. And you're going to actually see in this video new blood vessels that grew in the hearts of these patients.
But since receiving an experimental treatment for his blocked arteries, his pain is gone.
I really feel great.
Duke was one of the first heart patients in the country to be treated with a protein actually capable of growing brand new arteries.
That's the FGF1.
The genetically engineered protein is injected directly into the heart. Within days, a network of new vessels begins to grow around the blockage, increasing the blood supply. Dr. Lynn Wagner showed us the changes in one patient's heart.
We see a small, narrow main artery and not very many secondary and tertiary arteries. This is after the treatment. What we're now seeing is new blood vessels growing here off the end of this artery.
And the patients themselves?
Symptomatically, they're improved within a couple of weeks of the treatment.
Just ask Constance Donnelly.
Oh, I feel wonderful. I've never felt so good in the last 5 years.
But doctors already see potential in other cases where the blood supply needs a boost, such as strokes and diabetes.
So that woman we saw there, Constance Donnelly, she came into that trial 12 weeks earlier and was in a wheelchair. She was a cardiac cripple. So all the patients we treated in that trial couldn't have regular surgery. They couldn't have a bypass done. They couldn't have a stent put in. So this treatment really was their only hope. And you can see her there 12 weeks after we injected the growth factor into her heart. She was up and about. All right, well, let's move up into the brain. And I'm going to talk a little bit about stroke, Parkinson's, and then autism. So the brain is incredibly vascularized. It's the most highly vascularized, or the greatest density of blood vessels of any organ in our body. There are billions, literally billions of blood vessels in the brain feeding the billions and billions of neurons, which are very metabolically active. They're very fragile cells of the neurons, so they need a constant supply of blood. And if that blood supply is cut off, bad things happen in the brain. The critical crosstalk between blood vessels and nerves, it's called the neurovascular unit. So let's look in the brain. We have the large arteries go down to these smaller arterioles, or the smallest blood vessel is a capillary. And these capillaries and the arterioles are the ones that interact with the neurons. So here is a neuron. Basically, every neuron has a dedicated blood supply. This is a capillary, so the blood would fill the lumen here. And this would feed this neuron glucose, oxygen, and also take waste products and get them away from the neuron. So you can imagine if this blood vessel becomes damaged, it gets blocked from atherosclerosis, damaged from other environmental causes or genetic causes, the neurons in that area are going to suffer. And in fact, you can look at blood perfusion in normal people. This is using brain imaging. It's called functional MRI. You can compare blood perfusion both globally in the whole brain or in selected regions of the brain. And so look at a healthy 21-year-old. They have maximum blood flow, very well perfused brains. We know as we age, here's a healthy 65-year-old. They have about 25% less of the blood perfusion capacity in their brains. And some people speculate this is why our brains don't work quite so well as we get older. We forget phone numbers, we forget names. But in Parkinson's disease, there's a 50% reduction in blood flow. So this is in a very specific area of the brain, which I'll show you in a second. And if someone has a stroke in a specific area of the brain, you really knock back blood perfusion almost down to zero. All right, let me show you. We just have animal data. We've just started treating. We treated actually our first stroke patient just a month ago. But let me show you how our growth factor, again, by stimulating angiogenesis, can heal damage caused in an animal model of stroke. So this is a human, but and in humans, clots leading into the brain result in brain damage. Here's a stroke. So you have the core of the stroke, which is basically dead brain tissue, kind of an at-risk area of the penumbra which surrounds that. But you can create this very same situation in an animal. We can go into an animal, mouse, and tie off an artery in the mouse's brain and give that animal a stroke, and then treat that animal with our growth factor, with the FGF1, and see if we can heal the stroke area. And indeed we can. This is mice. These are brain slices. This is slices kind of going through the mouse brain. This mouse has been given a stroke, and here's the stroke damage. This white area is all infarcted or damaged brain tissue in this mouse. Another group of mice, we do the same thing, but we treat them with FGF1. This is intravenous treatment with the growth factor that we're developing, and you can see very nicely, compare this area to this area, very nice healing in this brain. We don't completely heal the entire stroke, but these animals are in much better shape than these animals. And in fact, we decrease the stroke volume by 57%. Now you can actually go in and look and see if we're growing new blood vessels. Again, remember FGF1 stimulates new blood vessel growth, which we think in the brain is then linked to new neuron growth. And in fact, we do. Here's, these are capillaries in the mouse brain, okay? Very dense growth of capillaries in the brain. What you don't see here is there are millions of neurons in this field that are being fed by these capillaries. So when you give the animal stroke, you decimate, you destroy the blood vessels in a particular area. So these are two groups of animals given a stroke. Again, a great reduction in the blood vessels. And then one group we treat with the FGF1 for 14 days. The other group gets a placebo or sugar water. You can see here in the drug-treated, the FGF1 treated animals, we're getting very nice regrowth of capillaries, not quite back to normal, but certainly better than these guys. These guys are desperately trying to grow new blood vessels, but not doing a very good job. These are clumpy, leaky, and these animals are not doing nearly as well. Now, we can't see neurons, the regrowth of neurons here, but we can infer that these animals are growing new neurons by doing motor skill testing. So we can actually test these animals on a standardized motor skill, which is, this is typical, this is a rotating bar. So this bar is rotating around, and normal mice with their claws and feet grab onto the rotating bar nicely. Here's animals we've given a stroke to and have healed their stroke with FGF1. So they're actually grabbing onto that bar nicely. But the placebo, the sugar water treated animals fall off this rotating bar. So in this animal model, we've shown we can grow new blood vessels, we can increase motor skills. So this really is ready for the clinic, and we've just begun our first treatment of stroke patients. These are patients who, it's not acute stroke, it's chronic stroke. So they've had a stroke, they've recovered for, let's say, 6 months to a year, but they have deficits. They have motor skill deficits, or they have speech deficits, and they're the people that we're now treating. Let me just talk briefly about Parkinson's, and then I'll go into autism. We and others feel that Parkinson's disease starts with a lack of blood flow to a very specific region of the brain, okay? So in Parkinson's disease, there's a very small area of the brain, it's called the substantia nigra. This is the region that is affected in Parkinson's disease. The dopamine, they're called dopamine secreting neurons, are located in this region, and they're pigmented. They're actually dark. That's why it's called nigra or black. So this area, very tiny area, very deep in our brains, is where the dopamine neurons are. And we feel that a lack of blood flow to this area results in the dysfunction of these dopamine neurons and is the causation of Parkinson's disease. So in a normal neuron, you have dopamine, which is a neurotransmitter being released. People have normal movement. In a Parkinson's affected neuron, you have much, much less dopamine being released. And this results in the characteristic movement disorder seen in Parkinson's, the tremors that people get, the gait, the walking disturbances. And so we believe if we can reestablish blood flow, we can reestablish normal neuronal function, and that we can reverse Parkinson's disease. And I'll show you data that we actually have been able to do this. Before we go into humans, the gold standard is to test the growth factor of our drug, FGF1, in a monkey model, a primate model of Parkinson's. You can give this little guy Parkinson's by injecting a neurotoxin into his brain. It's actually a herbicide, and it selectively goes to these dopamine neurons and destroys the dopamine neurons. And the monkeys come down with all the classical motor symptoms of Parkinson's disease. They have trouble walking around their cage. They have tremors. Let them out of the cage. They don't interact with their caregivers as normal monkeys would. So let me show you some data that we've gotten with FGF1. This is looking at motor scores. So 4 is normal movement of the monkeys. They're walking around happily. 1 is highly abnormal movement. So we give 2 groups of animals this neurotoxin, and then we have to wait. We have to wait almost 8 months for the monkeys to develop the Parkinson's disease. So at this point in time, both groups of animals have tremors, have walking disturbances, but only one group in blue do we give our drug, the FGF1. You can see here over a period of months, this is months on this axis, the group that gets FGF1 in blue, their movement abilities start to improve. At the end of the experiment, they're almost back to normal, but not quite. Where the placebo or sugar water treated animals in red still have very significant movement disorders. So there's a real significant difference between these 2 groups of animals. Now, we then asked, are we regenerating dopamine neurons in these monkeys that were treated with FGF1? Are we kind of treating the root cause of Parkinson's disease? That is the lack or this dysfunction, the dopamine neurons becoming dysfunctional. And in fact, we are. We can look in the brains of these monkeys and show that we actually are regenerating dopamine neurons with the FGF1. So these are brain slices through that area, the substantia nigra region of the brain. And in the FGF1 treated monkeys, you can see very clearly regrowth of dopamine neurons. In the animals that were not treated with FGF1, no new dopamine neurons. So we think we are addressing this root cause of Parkinson's disease, at least in this monkey model, regrowing these dopamine neurons, leading to these monkeys regaining a normal movement. Now, one other feature of Parkinson's disease, which occurs in animals and rats, monkeys, and humans, is plaque accumulation. So like in Alzheimer's disease, you have the beta amyloid plaque. In Parkinson's disease, you have what's called an alpha-synuclein plaque. And it's a toxic tangle of proteins, which is toxic also to the dopamine neurons. So our belief is in Parkinson's disease, you get lack of blood flow, choking off of nutrient supply to these dopamine neurons. And also you get this accumulation of this toxic synuclein plaque, which is not in control animals. And in the treated animals, the FGF1 treated animals, you can see we basically flushed away a lot of this toxic protein. So we think in addition to regenerating dopamine neurons, we're getting rid of this toxic plaque material. And these dual activities cause the Parkinson's disease to be reversed. So we've been in humans. We've treated now 80 humans with almost 80 humans who have Parkinson's disease, and the monkeys got FGF1 directly into the brain. We felt that was way too invasive for humans. So in collaboration with a group in Minnesota, we found that using a proprietary nasal spray that aerosolizes the FGF1 in, you actually can get a lot of the FGF1 up through the olfactory nerve and through this trigeminal nerve. It actually gets in and saturates the entire brain with the FGF1. And let me just show you one slide. So if you squirt FGF1 up the nose, it's widely distributed throughout the brain. This is just different areas of the brain. This is the substantia nigra. So this is Parkinson's, but other areas of the brain, hippocampus would be important. memory cortex, and we're comparing, this is intranasal dosing versus intravenous dosing. So we get about twice the amount in going up the nose, squirting up the nose versus giving an IV dose. So it's a very nice way of getting drugs such as FGF1 into the brain. So let me show you a few videos. So with Parkinson's disease, there's a number of tests you can do, motor skill test, and one is having the patients hold their hands out. This is looking for active tremors. And this is a patient, this will be on the left-hand side before treatment, on the right-hand side after treatment. So this is before treatment, you see significant tremor. This is 30 days after treatment with the intranasal FGF1. We think she's done much better. I'll show you that again. Okay, before treatment, after treatment. Another test that's done is the patients, you'll see in a second, they cross their arms across their chest, and we ask them to stand up. So this was another patient we treated. Actually, is an anesthesiologist, works at a very well-known clinic in Cleveland. And here he is again before treatment, and this is 30 days after he was treated with the intranasal FGF1. This particular clinical trial was done in the British Virgin Islands, very nice place to go for treatment. You can see here again, he's struggling to get up out of that chair, very common in Parkinson's disease, much more fluid motion. Yeah, he's really struggling here. So, and then finally, this patient has a very significant tremor in his right hand. You'll see in a second, and also a resting tremor in that hand. And then I'll show you. He actually sent us a video. He's from Texas. On his way home from the airport, he sent us a video of this tremor. So here, there's very significant tremor on the right hand. Not able to control it. So this again is an active tremor when you hold the hands out in front of you. And you'll see in a second he'll rest it on his thigh. You can still see this is resting tremor. So it's very significant resting tremor. So on his way home, in the airport, he took a video. He's a golfer. So actually 2 weeks later. So look at that right hand. Able to pick up a beer without much of a tremor. Again, we had a significant tremor in that hand. It's gotten significantly better. Now, I want to emphasize we don't advocate our patients drink alcohol. This was his own choice, but I think we're really excited about this treatment. And as I mentioned, we've treated 75 patients to date. The FGF1 is safe and well tolerated, no adverse events. And we've seen about an 18 to 82% improvement in motor skills, doing tremors. We have walking tests, finger tapping, toe tapping. So we're very excited about this, and we'll continue to be treating patients with Parkinson's. Okay, so sorry a bit for that long-winded introduction, but we've just started with autism, so we don't have a lot of patient data, but I wanted to give you a flavor for the drug we're using, that it's safe, that it can grow new blood vessels in the human body, that it works in the brain with stroke and with Parkinson's disease. And we think it's possibly a novel treatment to treat autism. So let me talk a little bit about vascular issues in autism. I told you earlier that it's been shown there's a lack of angiogenesis in the autistic brain. This is both a PET and MRI scan. This is a mouse, and this is an autistic mouse. So you can give a mouse autism by deleting the 16p deletion, which also occurs in humans. Humans with that deletion develop autism. But in this particular slide, they're looking with the MRI, they're looking at blood flow. This is the global brain perfusion. And the scale's not here, but blue is basically normal blood flow. And then as you develop blood flow problems, you get orange and reddish colors are less blood flow. So you can see in this particular experiment, a global lack of blood perfusion in the autistic brain. And we feel this leads, at least in these animals, to the dysfunctional behavior traits that are seen in these animals. What we think is going on, and what has been shown in these animals, is the lack of blood flow is due to what's called endothelial cell dysfunction. So all our blood cells are lined with endothelial cells. I showed you that earlier on. So in a healthy person, healthy blood vessels, optimal blood flow, healthy neurons. And then whatever causes autism or other neurodegenerative diseases, we think in autism, the blood flow becomes disrupted. We have endothelial cell dysfunction, leading to reduced blood flow. And importantly, things start leaking out of the blood vessels that are not good for the surrounding nerves. So here we see fibrinogen. Let's say fibrinogen. That is a very sticky protein that's normally involved in blood clotting. There's no way fibrinogen should be outside of this blood vessel, but it gets out and it coats neurons that are adjacent to the damaged blood vessel. Immune cells, immune infiltrates get out and they see this fibrinogen-coated neuron. And they say, this does not look normal. This looks foreign. And so you get an immune attack on this neuron, damaging it. So we believe in immune disorders such as multiple sclerosis, and also in diseases like autism, where there's endothelial cell dysfunction. This is one mechanism to get nerve damage. And we've seen in animals that we can heal that endothelial cell dysfunction. So here's highly dysfunctional endothelium, disorder, basically holes leading to leakage. And if we treat animals with FGF1, we can see over 30 days, we can restore the endothelium to a nicely ordered, this is an endothelial cell, nicely ordered cells inside the blood vessels, no leakage going on here. These are intact blood vessels. If we look at that in a histology way, again, disrupted endothelial cells, leakage, healing with the FGF1 at day 30. So these are nice, tightly packed endothelial cells, no leakage of blood vessels in these animals. So using this MRI, functional MRI, you can look at blood flow in normal and autistic brains. And these were in adults. And so in the autistic brain, red is reduced blood flow. And you can see in the autistic brain, there's definitely reduced blood flow in selected areas of the brain. Blue is normal blood flow. So you can see in the control brain, normal blood flow in these regions. And if you overlay the two, you can see definite decrease in blood flow in selected areas in the autistic brain. So here's normal, autistic. So what researchers have done now is they've looked at these areas of reduced blood flow and have seen if these areas correlate at all with areas that we know are involved in social skills, speech. And so let me show you a few examples of that. So this is one area of low blood flow. This is this red circle is an area of low blood flow in autistic children. So this is a normal child. This is a boy with autism. And what they do here, there's a screen. They have a TV screen in front of the children. And they're just dots, random dots that are moving around. And not much happens in this region. But then the dots rearrange and form a human being that looks like it's walking. And that activates social perception in this area of the brain. Again, and this lights up. This is looking, I believe it was with a PET scan, but this social perception is deficient in autistic boys, okay? So when the dots rearrange into a human being, normal people socially perceive that, kids with autism do not. Let me give you another example. This again is looking at brain activity, and the circle is an area that had low blood flow. And so what they do, they ask the children to think about hugging, all right? Getting hugged or hugging. And in a normal person, this activates this region, which the researchers said in the study is related to self. So you think about yourself being hugged. That area does not light up in autistic kids. So what the researchers talked here about is that the kids don't really, when you say hug, they don't think about themselves being hugged. They might think about say a dictionary definition of hugging, or they might think about watching someone get hugged in a play, but they don't think about themselves being hugged. So clearly difference between normal children and autistic children. So as we mentioned, we are treating autistic adults, and we've just completed treating our first autistic adult about a month ago. And again, we're using the same type of treatment plan that which we used with Parkinson's disease. We're squirting the FGF1 intranasally, 2 squirts up the nose. We do this every day for a week, and then we send the patients home with the drug, and they can do it at home for a period of months. But again, the FGF1 gets up into the brain through traveling to the olfactory nerves, which are at the top of our nose, and also the trigeminal nerve innervates the nasal passages. So we know through animal studies that we can basically soak the entire brain in FGF1. So our main test is IQ testing in the adults. This gentleman had a IQ test before he went to the British Virgin Islands where he was treated. He's back home now, and we're going to wait 3 to 6 months before we perform a second IQ test. We want to give his brain a chance to grow, hopefully new blood vessels and new neurons. But we are in touch with his mother, who reported, this is 3 weeks post-dosing. This is reports from his mother. So he's a 21-year-old. We've witnessed him spending half a day putting together and leading a puzzle, followed by playing a brain game, and then followed by playing on the computer. The mother says that these are things that he has not done in a long time. These are her words. She also said he has also made up words to a song, which was a skill he had when he was 17, and he has not done this in about 4 years. So again, promising. So actually, when he went to the British Virgin Islands, they got him a coloring book as a gift. He didn't touch it before he was treated, didn't touch it in the British Virgin Islands. And I guess he got that coloring book out today and started doing this all by himself. This is from the Autistic Adults Coloring Book. See, but I think it's pretty good coloring in my estimation. So he'll continue his treatment at home. We're going to continue treating autistic adults, and hopefully by this type of testing and also by IQ testing, we see a benefit. So let me just close here. One other recent finding is, and I've shown you in disease, so in Parkinson's disease, stroke, autism, we believe there's a lack of blood flow, but workers at Columbia University Medical School in New York City came out with a study and believe a lack of blood flow in our brains is why our brains don't perform well as we age. And they produced a very short video, which I'll show you in a second. But basically, what the study found is that we all have stem cells, these neural stem cells in our brains. We have pools of these stem cells. And children have them, babies have them, adults have them. In fact, 80, 90-year-olds have similar numbers of these neural stem cells. But what's missing in the older individuals is adequate blood perfusion to get these stem cells to divide and mature. So from neural stem cells, we get neurons, new neurons, so new dopamine neurons, say, or new memory neurons for Alzheimer's, and also these other brain cells, which are important for good brain health. So in the video I'll show you, basically they feel a lack of blood flow as we age results in the neural deficits that we see in the aging brain. So let me just run that. Yeah, so Time Health did this video, again, on the Columbia University Medical School study, and we could not agree more with it. We believe blood flow in the brain is very important, not only to possibly reverse diseases such as autism and Parkinson's disease, but also maybe very important in healthy aging. Certainly people, I think, would take a few squirts of FGF1 up their nose every other day or so to ward off the ravages of aging. So I hope I've given you adequate evidence today that blood flow, angiogenesis, blood perfusion is very important to health, and that it can, drugs that stimulate this process can be useful to combat different diseases. So I welcome you to visit our website. It's very simple, zgm.care. On that website, we have lots of other videos you can watch, treatments for other disease categories. We have written white papers. I wrote a white paper on autism, which we'd be happy to send you. And also, very importantly, patients with autism or Parkinson's disease, you can fill out a form there and get on our clinical trial list. We can let you know where the trials are happening, when they're happening, and you can sign up for that. We then would interview patients to make sure they meet the inclusion and exclusion criteria. So again, thank you for your attention, and I'll be around later to answer any questions. Thank you.